Hello friends, today we'll discuss questions of digestive system. Some questions are repeated or sometimes the same question is asked in long question and short note. I also have included in the same manner so that you can prepare the same question to write as full question or short note. Starting with long questions. 1. Write the composition and functions of salivary secretion. 2. Describe the movements which are responsible for swallowing of food. 3. Describe the mechanism and regulation of gastric secretion. 4. Describe composition, function and control of pancreatic juice secretion. 5. Discuss the functions and regulation of bile secretion. Enumerate difference between liver and gallbladder bile. Add a note on enterohepatic circulation. Short notes. 1. Enteric nervous system. 2. Functions of saliva. 3. Saliva. 4. Functions of saliva and regulation of salivary secretion. 5. Deglutition. 6. Deglutition reflex. 7. Phases of deglutition. 8. Gastric motility. 9. Gastric secretion. 10. Regulation of gastric secretion. 11. Mechanism of HCl secretion. 12. Mechanism of gastric acid secretion. 13. Cephalic phase of gastric secretion. 14. Gastric phase of gastric secretion. 15. Gastric juice. 16. Functions of gastric juice. 17. Gastrine. 18. Gastric emptying and factors affecting it. 19. Gastric function test. 20. Describe the pathophysiology of peptic ulcer. 21. Sham feeding. 22. Postprandial alkaline tide. 23. Functions of gastrine. 24. H. pylori, Helicobacter pylori. 26. Secretine. 27. CCK-PZ, cholecystokinin pancreatozymin. 28. Pancreatic juice or pancreatic secretion. 29. Composition and functions of pancreatic juice. 30. Regulation of secretion of pancreatic juice. 31. Exocrine functions of pancreas. 32. Functions of pancreatic juice. 33. Role of pancreatic juice in digestion. 34. Bile. 35. Functions of bile. 36. Bile salts. 37. Role of bile salts. 38. Functions of liver. 39. Functions of gallbladder. 40. Enterohepatic circulation of bile salts. 41. Discuss the different movements of small intestine. 42. Succus entericus. 43. Movements of intestine. 44. Movements of small intestine. 45. Movements of large intestine. 46. Physiological importance of bacterial flora in large intestine. 47. Peristalsis. 48. Constipation. 49. Vomiting. 50. Gastrointestinal hormones. 51. Defecation. 52. Lactose intolerance. 53. Balanced diet. 54. Digestion of carbohydrates. 55. Digestion of fats. 56. Proteolytic enzymes of digestive system. 57. Dietary fibers. 58. Role of fibers in diet. Applied physiology questions. 1. Pathophysiology of peptic ulcer. 2. Describe acid secretion in stomach and write in brief about peptic ulcer. 3. Describe functions of stomach and gastric function test. 4. Vomiting. 5. Movements of small intestine. 6. What is jaundice? Write the characteristic features of different types of jaundice. 7. Jaundice. 8. How will you investigate a patient having jaundice? 9. Liver function test. Give reasons in 2 to 3 sentences. 1. What is the difference between hunger and appetite? 2. Presence of food is not necessary for cyclic secretion of saliva. 3. Role of salivary amylase in starch digestion. 4. Salivary secretion plays a role in maintaining healthy oral tissue. 5. Salivary secretion occurs even when there is smell of food. 6. Deglutition induces apnea. 7. Unless apnea occurs, deglutition is difficult. 8. Gastric mucosa is well protected against HCl. 9. Gastrectomy leads to megaloblastic anemia. 10. What is postprandial alkaline tide? 11. Alkaline tide is observed after food intake. 12. Achlorhydria is not associated with alkaline tide. 13. Achlorhydria results in pernicious anemia. 14. Enumerate proteolytic enzymes in gastric juice. 15. Vagotomy affects gastric secretion. 16. G cells or gastrin cells. 17. Hypokalemia is often a feature of patient of hypertrophic pyloric stenosis. 18. HCl leads to partial digestion of proteins. 19. Importance of HCl in gastric juice. 20. Importance of Pavlov's pouch. 21. Importance of shame feeding. 22. What are intrinsic and extrinsic factors? 23. Important functions of gastric secretion. 24. Pancreatic juice is alkaline in reaction. 25. Lack of exocrine pancreatic secretion causes steatorrhea. 26. In oral dehydration solution, sodium is combined with glucose. 27. Secretin is known as nature's antacid. Explain. 28. Helicobacter pylori causes peptic ulcer. 29. Bile salts are cholagogue. 30. Pes patches are defense mechanisms. 31. Micelles are necessary for absorption of vitamin A. 32. Atropine causes dryness of mouth. 33. Bile salts are necessary for digestion of fat. 34. Urine bilirubin is absent in hemolytic jaundice. 35. Steatorrhea is seen in obstructive jaundice. 36. Steatorrhea is seen in absence of bile secretion. 37. Neonates usually suffer from hyperbilirubinemia. 38. Phototherapy is given in hemolytic jaundice of newborn. 39. Enterohepatic circulation of bile is necessary. 40. Bile salts are necessary for digestion of fat. 41. Transport of iron from gut to the blood circulation. 42. Slow wave potentials in smooth muscle are called pacemaker waves. 43. Haustral shuttling increases water reabsorption. 44. Migrating motor complex. 45. High fiber diet reduces the blood cholesterol level. 46. Defecation after meal is very common in children and infants. 47. There is diarrhea in lactose intolerance. This is all about digestive system questions. Thank you.